Have you ever noticed yourself or a loved one forgetting little things and wondered if it's just part of getting older? What if those moments of forgetfulness were actually your brain trying to tell you something important? Trust me, this isn't about scaring you. It's about understanding and empowering yourself. Dementia affects millions worldwide, and it's often misunderstood. Many people still think it's an unavoidable part of aging. But is that really the case? So, what is dementia? Dementia is not a single disease. It's a term used to describe a group of symptoms that affect how the brain works. Things like memory, decision-making, language, and even behavior. It happens when nerve cells in the brain become damaged or stop working properly, making everyday tasks more difficult than they used to be. Here's something important to know. Dementia is not just a normal part of aging. Sure, it's more common in older adults, but it's not something everyone will experience. Losing your mental sharpness is not an inevitable part of getting older. That's why it's so important to get a proper diagnosis if symptoms appear. The sooner you know what's going on, the sooner you can take action. It's totally normal to experience mild memory changes as you grow older. Maybe you forget a name here or there, or you misplace your keys once in a while. That's just part of aging. Dementia, though, is something entirely different. It's a significant decline in mental abilities that can make even simple daily tasks a struggle. If you or someone you care about is experiencing persistent memory issues, confusion, or other changes, don't brush it off as just getting older. A medical evaluation is key to understanding what's really going on. Not all dementia is the same, and understanding the different types can make a world of difference in how it's managed. Here are the most common ones. Alzheimer's disease. This is the type most people think of when they hear the word dementia. It often starts with memory problems, like forgetting recent conversations, and progresses to difficulties with language and changes in behavior. It's the most common form, and about 60 to 80% of dementia cases. Vascular dementia. This type is caused by reduced blood flow to the brain, often due to strokes or other circulation issues. It can lead to problems with thinking, memory, and even physical abilities. Lewy body dementia. This form comes with some unique symptoms, like vivid visual hallucinations, unpredictable changes in cognitive abilities, and physical symptoms similar to Parkinson's disease. Frontotemporal dementia. Unlike the others, this type primarily affects a person's personality, behavior, and language skills. It tends to appear earlier in life, sometimes as early as in a person's 40s or 50s. Knowing which type of dementia someone is dealing with is crucial because it helps doctors determine the best course of treatment. Now let's get into some of the early signs of dementia that often go unnoticed and practical steps you can take today to keep your brain healthy. We all know how important a good night's sleep is for feeling sharp and focused. But what if your sleep patterns were a clue to something deeper, like dementia? Sleep disturbances are surprisingly common in the early stages of dementia, and they don't just affect rest, they can make day-to-day life even harder. For example, someone might have trouble falling asleep or wake up multiple times during the night. Others may feel sleepy during the day, no matter how much rest they got the night before. Certain types of dementia, like Lewy body dementia, can cause vivid sleep disturbances such as acting out dreams, kicking, talking, or even shouting in their sleep. This is called REM sleep behavior disorder, and it can appear years before other dementia symptoms. Quality sleep is critical for brain health. During deep sleep, your brain works like a cleaning crew, clearing out toxins and repairing itself. Without it, memory, mood, and cognitive function take a hit. If sleep problems are persistent, it's not just an annoyance, it could be an early warning sign. Addressing these issues early with a healthcare provider can make a world of difference. We all forget things from time to time, right? Maybe you misplace your phone, your keys, or can't recall the name of a person. That's normal. But when memory loss starts interfering with everyday routines, it might be a sign of something more serious. People experiencing dementia don't just forget where they place their keys. They might put them in the freezer or leave them somewhere completely unusual. They might forget entire conversations, repeatedly ask the same questions, or miss important appointments, even if they were reminded just minutes earlier. This isn't the kind of forgetfulness that happens once in a while. It's persistent, disruptive, and can make it hard to carry out normal daily tasks. Over time, these lapses can cause frustration, confusion, and even embarrassment. And while everyone's memory changes slightly with age, dementia-related memory loss goes far beyond typical aging. If you notice this pattern in yourself or someone close to you, it's worth talking to a healthcare professional. Have you ever been in the middle of a conversation and suddenly couldn't find the word you're looking for? For most of us, it happens occasionally, but for someone with early dementia, it happens a lot. They often struggle to find the right words. They might pause frequently mid-sentence, use vague terms like that thing instead of the actual word, or even call a chair a table. Over time, these language issues can make conversations frustrating and even emotionally exhausting that they might start avoiding conversations altogether. They may feel self-conscious about their struggles and choose silence over the possibility of making mistakes. These communication challenges aren't just a nuisance, they're a window into how dementia is affecting the brain's language centers. Getting lost in familiar places. This is where things get really scary. Picture someone who's lived in the same neighborhood for 30 years suddenly unable to find their way home. We're not talking about taking a wrong turn. I mean completely losing all sense of direction in a place they've known forever. It's like their internal GPS has suddenly stopped working. They might feel confused, anxious, and completely disoriented in spaces that should feel as familiar as the back of their hand. This type of disorientation occurs because dementia affects the parts of the brain that handle spatial awareness and memory. The person might forget familiar landmarks or fail to recognize places they've visited countless times before. They might also struggle to follow directions or get lost in their own home. Disorientation can put someone in potentially dangerous situations, especially if they wander into unfamiliar areas. Difficulty performing everyday tasks. Daily routines you barely have to think about, like making coffee, paying bills, or using a smartphone, can suddenly feel confusing or overwhelming. This isn't just forgetting a step here and there. It's losing the ability to complete tasks altogether. These challenges indicate significant disruptions in executive functioning, the brain's ability to help us plan, organize, and carry out tasks. Over time, these challenges can disrupt their ability to maintain independence, creating frustration and worry for both the individual and their loved ones. Physical changes in movement and coordination. People in the early stages of dementia may show signs of slowed movement or struggle with balance, even when there are no obvious mobility problems. For example, someone might stumble on flat ground, hesitate when stepping off a curb, or appear unsteady in situations that used to feel natural. These changes aren't just about aging joints. They're often linked to disruptions in the brain's motor control systems. Other signs to watch for include a stooped posture, trembling hands, or difficulty with tasks that require fine motor skills, like buttoning a shirt, tying shoes, or even walking might become harder. While it's easy to attribute these changes to aging or joint issues, they might actually be part of something bigger when paired with cognitive challenges. And catching these physical signs early could help prevent falls and ensure that the underlying causes are addressed. Frequent, unexplained falls might signal more than just clumsiness. They could be an early warning sign of dementia. We're not talking about the occasional trips or stumbles, but consistently losing balance, struggling to navigate even flat surfaces, or having difficulty on stairs. Studies have shown that individuals who later develop dementia often experience balance issues and frequent falls years before cognitive symptoms appear. These incidents aren't simply due to clumsiness or aging. They're often caused by changes in the brain, areas that control motor function and spatial awareness. If falls happen regularly and without a clear reason, it's worth looking into. Addressing these physical changes early can help prevent injuries. Have you ever noticed someone who used to love chatting and socializing suddenly becoming quiet and withdrawn? Social withdrawal can be a subtle but significant early sign of dementia. It's more than just needing a little time alone. People experiencing this might stop attending family gatherings or avoid meeting up with friends. Even in one-on-one interactions, they may seem distant or disengaged. This is not just stress or fatigue. It's often because they find it increasingly difficult to follow conversations or remember details, which can be frustrating and embarrassing. They might lose interest in topics they once enjoyed or struggle to process the back-and-forth nature of a discussion. Over time, this withdrawal can lead to isolation, which can further accelerate cognitive decline. If someone you care about seems to be pulling away from social interactions, don't overlook it. It could be a sign that they're struggling with more than just mood. A noticeable disinterest in conversations or social activities can be another early indicator of dementia. We've all misplaced our keys at some point, but dementia takes this to another level. A person might put their glasses in the fridge, store their wallet in a laundry basket, or toss important documents into the trash without realizing it. What's worse is that they may not remember where they put the item, or even that they moved it at all, which can lead to frustration, confusion, or even accusations of theft. These are not intentional mix-ups. It's the brain's filing system going completely haywire. Everything gets stored in the most illogical places imaginable. Now let's talk about protecting your brain because it's simpler than you might think. Small changes can make a big difference. Here are tips to keep your mind sharp and lower your risk of cognitive decline. Stay physically active. Just 30 minutes of moderate exercise, like walking, can improve blood flow to your brain and support overall brain health. Eat smart. Follow a diet rich in brain-boosting foods like fish, olive oil, whole grains, and fresh vegetables. Your brain thrives on good nutrition. Challenge your mind. Keep your brain engaged with puzzles, strategy games, or learning new skills. The more you use it, the stronger it stays. Socialize regularly. Spend time with family and friends. Staying socially connected can do wonders for your cognitive and emotional well-being. Get quality sleep. Aim for 7 to 8 hours of rest each night to give your brain the time it needs to recharge and clear out toxins. Ditch harmful habits. Avoid smoking and limit alcohol. These habits can take a toll on your brain over time. Monitor your health. Keep track of your blood pressure, cholesterol, and overall heart health. What's good for your heart is also good for your brain. If you've noticed any of the signs we've talked about today in yourself or someone close to you, don't ignore them. Early detection and intervention can make a huge difference. By consulting with a healthcare professional early on, you can access treatments, therapies, and support systems that can improve quality of life and slow the progression of dementia.